Hello, everyone. I am happy to welcome each and every one of you to today's webinar, where we will be discussing the future vision for telehealth and patient engagement at Mend. My name is Brooke. I am a junior marketing coordinator here at Mend. Today, I have the privilege of joining Matt McBride, CEO at Mend. Matt, how are you doing today?
I am doing amazing. This is a presentation I've definitely been looking forward to talking about and presenting with everyone today. So very excited to be here.
All right. The agenda is rather simple today, but it is packed with innovation. Matt is going to take us through the patient journey before, during, and after the visit. What does the future hold at Mend? Well, we're about to find out. Finally, we'll round out today's webinar with a Q&A session. Starting now, you can use that fancy Q&A box at the bottom of your Zoom toolbar, and we'll get to as many questions as we can at the end. All right, let's dive in. Matt, I never expected to see the Star Trek tricorder in one of our webinar presentations. Can you please explain?
Yeah, I think growing up as kids, maybe watching Star Wars, watching Star Trek, seeing some of these wild futuristic sci-fi technologies and just kind of being fascinated by that. I think we all were. And, will we see a future where some of these things exist, right? And so for healthcare specifically, I think the tricorder really stands out as this amazing device that can sort of scan and diagnose instantly. We've even seen Qualcomm, as an example, put out an X Prize for the Qualcomm tricorder, putting a substantial amount of money out there for people to come up with technology like this. And actually, I think it's probably not going to be a device like this. I think it's going to be much simpler, and I think we're going to have some exciting stuff here near the middle of the presentation on how this technology is likely to be presented and what the first version of this is going to look like. So I think we're closer than maybe a lot of people expect to having some exciting futuristic technologies that maybe we saw when we were kids.
Matt, this tricorder reference sounds intriguing. I can't wait to see how that plays out. Every patient journey begins before the appointment scheduled date and time. Let's take our first glimpse into the future here at Mend. In our last webinar, we covered that Accenture patient surveys found that 68% of patients want to book, change, or cancel appointments online. Patient self-scheduling is gaining in popularity. What can you tell us about patient self-scheduling, Matt?
Yeah, so just as patients are maybe able to book appointments at a gym or a barber shop or all these other different places, they are demanding and wanting and expecting and will be seeking their healthcare providers based on these types of experiences. So, there's no doubt that patient self-scheduling or making modifications to an appointment is going to be a significant part of the future. Now, these technologies exist today. I think a lot of organizations in healthcare feel that their schedule is too complex to allow patients to book their own appointment. That I don't think is the case any longer. It can be made simpler. You can look at things like geography, age, type of insurance they have, all sorts of other qualifying factors to present the right providers and the right availability and the right locations to patients. I think the complexities have been built into simple experiences that can be integrated, that can be presented to a patient. Um, Across our entire customer base, it's still a relatively small percentage of organizations that are willing to venture into patient self-scheduling. And I think there's a big opportunity to really expand beyond the phone call, right? To open your doors to book business on the schedule 24/7, 365, and not only when somebody is available to answer the phone. And we definitely have a large population of folks self-scheduling telehealth visits, but there does seem to be a reduction in no-show rates when a patient self-schedules their own appointment. So I definitely think there are rewards to doing this. It's technology that's available now. It's just not maybe in practice. And in the future, this is going to become the norm. I would just also add that maybe you just want to dip your toe in the water. You're not ready to let somebody book a whole new appointment. Maybe you only want to let established patients book their own appointment. You could offer just the ability to modify an appointment as a starting point, or offer this up to established patients. So there's a lot of different ways to approach this and begin this, but there's no doubt that all of the surveys are pointing to patients want this. They're looking for healthcare organizations that have this. They're going to be selecting their healthcare providers based on these types of conveniences. So something that will definitely be a big part of the future that you can begin to work on now.
After I book an appointment with a doctor, I usually receive some kind of reminder. My doctor calls the day before to remind me of the appointment. How will appointments be different in the future?
Yeah, so in the future, AI is going to assist and help solve challenges around no-shows, late cancels, maximizing productivity. Some of the data, some of the meta-analysis data for the United States points to an average no-show rate of 23%. So if you think about that for a second, that's almost 1 in every 4 appointments may not be real on the schedule. So let's expand that out to 4 months of appointments. And so now 1 month worth of appointments is not actually real. So AI is going to play a big role in not only analyzing the schedule, assessing the risk of who is unlikely to attend, but from there, patient engagement technologies will reach out automatically to the patients on behalf of the healthcare organization and just simply ask the person, are you coming or not? And making it easy for them to do that through a simple text or email message. And so this is newer technology. There have been some health systems and other groups that have used AI to assign risk. That's only half of the battle here. You have to be able to look at risk, and you have to be able to then engage automatically with the patient. And then you've got to be able to reassess the risk after that happens, after you now have this patient engagement data. So Mend has this technology in beta with customers today. And we will actually have an upcoming webinar and ebook towards the end of July, where we're going to go in depth into this technology. But AI is going to play an important role in the future in making sure that the scheduled appointments are real, and really helping to make the schedule as real as possible, which is going to make sure that patients have access, right? And there be shorter wait times to book an appointment into a doctor's office, and maybe when you arrive for your appointment, there'll be shorter wait time. So there's a lot of potential benefit here for these types of technologies.
Making a prediction sounds interesting, but I'm a little skeptical. How accurate is this and how does it work?
Yeah, so when you um, add in this component of patient engagement, right? At the end of the day, we're not using AI to make a decision, right? The AI is just trying to understand who should we communicate with a little bit differently, right? So who should we go out and really try to get that confirmation from? Who should we go out there and maybe make it easy for them to cancel, make it easy for them to reschedule, make it easy for them to confirm, right? So in that situation, the AI doesn't have to be that accurate, right? We're just looking at, well, who do we want to maybe communicate differently with, maybe over communicate with, and try to get them to tell us, are you coming or not? And so once you've now added in this component of patient engagement and you're just reaching out to the person saying, hey, Brooke, are you coming? Yes or no? Well, now we're pretty accurate, right? We're not just relying on a AI algorithm that's looking at different factors. We're now engaging the actual person, engaging around the actual appointment. And now our certainty can be far more higher at each individual appointment level. So again, this is something we'll be taking a more in-depth look at at the end of July, sharing what some of the accuracy rates look like before we engage, and kind of what happens when we engage the patient. But I think this is going to be how appointment reminders and how the schedules will evolve to really maximize, increase access, and allow healthcare organizations to help more people.
So the MEND patient attendance predictor is fully automated for a healthcare organization, and it uses appointment details and MEND patient engagement data to remove no-shows from the schedule. That is very exciting technology here at MEND. According to Accenture market research, 70% of patients want to receive reminders via email or text message. How does MEND reminders work?
Yeah, so we will integrate with the master scheduling system, bring over the patients and appointments, and from there, send out text, email, or voice notifications in different languages. So communicating in the language with the person, and it's all fully automated. So I think this is a key part of AI that will predict attendance, is then having the content of those reminders change using AI, and then opening up the ability for folks to confirm, cancel, reschedule, to just make it easy from a text message. You just make it easy. This is what consumers want: text message, click a link, tell us, are you coming in or not? Do you need to reschedule? So on and so forth. Having that happen 24/7, 365, all synchronized back to the master schedule. So, a lot of organizations are using text and email for reminders. There are a lot of organizations still making manual phone calls. In the future, I think it's going to be expected from patients that they receive, text, email, and that they do have some ability to, modify their appointment or make a change if they need to.
On average, customers of MEND digital forms get the majority of forms back very fast, and we average an 86% completion rate overall. Matt, can you take us through the MEND digital forms experience?
Yeah, absolutely. And so, in the future, PDFs on a website, clipboards, paper forms when you arrive, these are not the types of digital health experiences that consumers, patients, clients, whatever you call them, are looking for. So I think not only do digital forms have the ability to create a digital experience, and we see very high engagement rates with them, there's several other benefits. One being a lot of this information can be integrated and moved right back into the chart. Even, discrete data can be moved so that staff doesn't have to manually transfer this information anymore. And with administrative burdens on the rise, being able to sort of have this automated, right? All of the appointments, all of the patients are integrated based on the type of appointment. Forms are going out automatically. As they're completed, the information is moved back automatically into the right place within the chart. Even if you want to get pictures, you want to get the photos of insurance cards, you want to get payment, you want to get a driver's license, you want to get maybe a picture of something for an income verification form, you want to do clinical assessments, any sort of electronic agreements, treatment plans. All of these things can be moved into a digital experience today. And so what that does is it gets patients engaging in their care before they arrive. And our customers continue to say that when the forms are done in advance of the appointment happens. And so I think in a lot of ways, this is the new appointment confirmation of the future, right? You sending the forms out, making it very easy, just a complete frictionless experience. Click a link, date of birth, do your forms, have everything flow back automatically. We've taken stress off of staff. We've given consumers the experience they want. And now I think we have a much stronger appointment confirmation because we've got the person investing their time, investing their information into their care before they've ever arrived.
Okay, so now it's almost time for the appointment to happen. When I think about checking in at my doctor's, I just show up and put my name on a sign-in sheet. Matt, how will the check-in process evolve in the future?
Yeah, so I think the majority of folks listening today have probably booked a plane ticket and have checked in, digitally 24 hours in advance, right? To maybe you changed your seat, maybe you've wanted to check some luggage, you've made payments. All of these things are being done digitally, right? You can even get your boarding pass now completely digitally. And these are the types of experiences that more and more consumers are looking for. And so in healthcare, this type of experience is pretty rare, but in the future, and we're going to dive into some of these touch points in the future, you will be able to check yourself in digitally. And in the not very distant future, you'll be able to confirm your appointment, do forms, make payments, and really complete all of the steps necessary to be ready to be seen by the provider before you ever arrive.
Payments during an automated check-in process seems like a very important step for a healthcare organization. Matt, can you elaborate more on how this will work for the audience today?
Yeah, so I think almost all consumers are paying electronically in some form or fashion, right? Whether you're paying electronically on a website, you're doing bill pay through the bank, you're using a credit card or tapping at the grocery store or the gas pump. There's pretty much the majority of us have moved to some form of electronic payment. And studies are showing 85% of consumers want to pay electronically, specifically for their medical bills. So one of the areas that Mend is working to address in a digital check-in process is to allow for co-payments or self-pay amounts or other amounts to be paid as part of a digital check-in process, much like if you're checking into the airline and you want to check that luggage that we were talking about, or you want to upgrade your seat, then you're able to just easily make the payment right then and there. You've got, Amazon that, pretty much just allows you to, pay with a click, pay with your voice through Alexa. I think consumers are looking for these types of experiences. And when you do collect that payment in advance of an appointment, not only are you kind of giving the consumer that experience, now you're pretty certain that that appointment is going to happen, right? If somebody's made a payment, like they're coming in, and then it can be automated. This can be synchronized. This can be integrated back to the practice management system. That payment can be recorded, and that payment can be applied to the right appointment all automatically. So it can really be a win all the way around. So, what does the future of healthcare look like? There's going to be digital check-in experiences, and payment is going to be an important piece before you arrive to that appointment.
Telehealth played a massive role in helping to manage COVID and is now mainstream. Mend is a platform that works on very low bandwidth connections, but some small percentage of folks can still struggle. What does the future hold for this problem?
Yeah, so telehealth is likely to be a big part of the future, and we'll talk about that a little bit more. There's obviously huge benefits to telehealth when it comes to no-shows. There's been studies that have come out recently proving telehealth visits are more likely to have a single-digit no-show rate. We certainly see that from our customers across the board. If you're running a telehealth program and you're not seeing single-digit no-show rates, there's some type of fundamental issue there with missing contact information, or something is going on. So I think this is a great way to improve compliance, improve outcomes, maybe even add in additional touch points to the patient that we're trying to help, and is likely to be a key part of value-based care moving forward into the future. Now, there are still access to the technology, access to bandwidth. There are going to be percentages of people that struggle. And so we do have workflows like kiosk mode as an example, or maybe that person comes in, there's still some staff that's maybe helping them, and they're in front of a screen and accessing the provider remote. That may not always be possible. So, we're working on AI today, and we do have risk factors developed and working that we're kind of continuing to tweak and working towards sharing this data with our customers. But we're going to be able to look at things like history, prior bandwidth. Have they done other things successfully, right? Have they completed digital forms successfully? And really, assess that risk of who might need a little bit of additional help before the visit to make sure that visit happens successfully, and then maybe build in some automated intervention to reach out to that person in advance, test, make sure that they're able to test their equipment, make sure they understand how to connect, that they're comfortable. If there's a problem, they know where to get support. This is going to be, I think, an important part of the near future as we try to compensate with those gaps of where technology and bandwidth might not quite be available for a patient yet.
Okay, so Matt, is this what the tricorder reference was all about?
Absolutely. So there are, I think, this is the type of stuff that I think gets people really excited, and you can see me being a guinea pig there. And with 60 seconds, 30 seconds of webcam footage, this is not an advanced web camera at all. I think the camera I used is maybe 4 or 5 years old. This could be a camera on a smartphone device, any device. and cameras have really become ubiquitous now. I mean, they're everywhere. You can, probably look at the room that you're sitting in now, and there's probably more cameras in the room than people with all of the smartphone devices, and it's on every laptop, tablet, etc. I haven't seen anything FDA approved yet, but this is something that we're looking to put out in the very near future with some strategic partnerships to be able to capture vitals, whether it be an in-person visit or a telehealth visit. So I think these digital check-in processes with payments, forms, the AI appointment reminders, these are for any type of appointment, right? The future is not going to discriminate on virtual or in person. And we're going to be able to easily collect heart rate, breath rate, blood pressure, heart rate variability. I've seen as many as 40 different vital signs collected through a web camera. So still new, still pioneering type of emerging technology. Something that I think the FDA is trying to figure out how to deal with, but I think from what we've seen, accurate enough to say, maybe this person should come in and we should take a closer look, right? So very, very easy, very exciting. And I think that the future tricorder is likely to be, a combination of that camera and microphone that we all carry around with us in our, our pocket or purse or backpack or whatever. That is likely, with a combination of machine learning, that is likely to be the tricorder of the future, and something that we're quickly working towards offering in a digital check-in experience.
Capturing vitals like blood pressure with only a web camera is mind-blowing. Great stuff there. Now, Matt, the enhanced virtual waiting room experience is extremely unique to Mend and certainly one of a kind. Can you explain this innovative waiting experience that Mend has created?
Yeah, so as we talked about, telehealth is going to be an important part of the future. And maybe even in-person waiting experiences will change for patients with more entertainment. But with telehealth specifically, you can have a screen that says waiting for host to connect, waiting for provider to connect, or you can put valuable educational content in front of the patient while they're waiting. So some data for you. In 2021, we saw 19 years of total wait time on our platform alone. 19 years of time was spent waiting. That's about 13 and a half minutes on average per scheduled appointment. We do have some other, we have other types of appointments, ad hoc, et cetera, that are a little bit different. But on average, scheduled appointment, 13 and a half minute wait time platform wide. So you can have an experience that provides content on heart health, healthy eating, how to meditate, yoga, TED Talks, maybe even custom videos about your organization, things you're doing in the community, other programs you offer, whatever sort of valuable information. And that can be an educational or inspirational time spent waiting for a patient, where they don't feel like they're just waiting, right? They're learning something. And this is an organization that's willing to think about this experience and willing to put some content out there that could benefit me. And what we've seen in our data, where we have this enabled, where we have this disabled, is we see a huge increase in patient satisfaction when you look at the waiting experience and when you put valuable, helpful information there. So something that's available today, but in the future will be commonplace. These waiting experiences will change and become opportunities to educate folks on how to be, healthier and happier. So this is something that we have for our customers today, but will be a commonplace, and maybe even the in-person experiences will change.
Okay, before we move on, we have a poll question for everyone. On a scale of 1 to 5, how satisfied would you say your patients are with your telemedicine experience? Everyone should be seeing the question now. We have 1, not at all satisfied, to 5, extremely satisfied. Or if this doesn't apply to you, we have the last option there. I'll give everyone a few minutes to answer here, and then I'll share the results. I still see a few people answering. Okay, so it looks like 35% of you said 3 on a scale of 1 to 5. 20% of you said extremely satisfied, and then 15% are not currently using telemedicine. All right, and we'll continue here. 1 out of every 5 people in the US do not speak English as their primary language. Men currently integrates with all the major translation services to connect translators over audio for virtual visits. But what does the future hold here?
Yeah, so in the future, language barriers are going to be a thing of the past. And there's going to be some other slides around language barriers, but whether somebody is deaf or hard of hearing and they need captioning in real time using AI, or whether they just don't speak the same language as the provider, those types of captions and translations are going to be automatically done in real time. Now we're starting to see this in different video conferencing technologies, telemedicine technologies. This is something that we're working towards as well for telehealth visits, but something that is likely to be available for in-person visits as well, right? So the days of calling in a translator, maybe days of the past, where with a smartwatch or right inside of your telemedicine visit, all of the captioning and translations will be in real time to really facilitate that care between the patient and the provider, and just make it so that everybody can get the care they deserve, the care that they need in the very near future. So exciting stuff.
There was some really cool and exciting innovations coming to the patient journey before the visit. Let's shift gears and talk about during the visit now. About 10 million people in the US are deaf or hard of hearing. Matt, how will this technology help address these patient experiences as well?
Yeah, so similar to how a web camera is able to detect vitals, in the near future, a web camera will likely be able to interpret sign language and be able to take sign language, signing, and turning that into real-time captions. And then, of course, we also talked about in the prior slide the ability, for real-time captioning of anything that the provider might be saying to the patient, or vice versa. And then if there are any language barriers as well, being able to then take that text and translate it into whatever language that the patient needs. So again, language barriers, scheduling resources, whether it be virtual or in person, will really be a thing of the past. And AI will help assist and really close and eliminate a lot of the communication barriers, or just the administrative work that goes along with dealing with any sort of language barriers. So something that we'll definitely see in the near future.
Physician shortages and burnout are on the rise and a troubling issue for healthcare moving forward. What role could technology play in the future to solve this?
Yeah, so we've talked a lot about the patient side, the patient experience, and of course, capturing this information electronically, moving into the chart automatically. Just getting rid of that administrative work, definitely opens the door for staff to focus on other things, like care, customer service, etc. But a huge problem that has to be addressed is the amount of time that physicians and clinicians are spending documenting encounters. There have been some stats that have come out saying that as much as 50 to 60% of a clinician's time could be spent doing documentation, and other leaders in government coming out saying that this is a huge a huge problem, a problem that is reaching a breaking point. And so through partnerships, this is something that we are exploring. And there are pioneers and innovators working on this now. So I don't think this is something that's years and years away. This is something that is maybe 1, 2, 3 years away, where we are seeing AI assistants take notes and handle a lot of the charting and coding automatically, whether this be in a virtual visit or whether this be in person, and maybe utilizing that microphone on the laptop, smartwatch, smartphone, tablet, what have you, being able to process the conversation in near real time and produce notes, produce coding, produce and handle a lot of the administrative burden automatically. So this is definitely a problem that has really grown as the emergence of electronic medical records and various government requirements and other requirements have taken hold. And I think this is a huge burden that we've got to remove from our clinicians in the future. And in the future, I think AI is going to be taking this work on and really changing the way care is provided and really changing the interactions between patients and their providers.
The future is looking amazing, and technology is going to play a very important role. So far, we've covered the patient journey before the visit and during the visit. Let's move on to after the visit. We all know how important payments are, and we covered copays and other payment before the visit occurs earlier in the presentation. Once a claim is processed after a visit, if the patient still owes a balance, what will this look like?
Yeah, so payments are a huge piece. And, as we've kind of talked about, there's a big consumer demand for electronic payments. I still get paper bills. I think a lot of people are still getting paper bills. Some of the data that we found says 75% are still using paper in manual processes. And we definitely have customers in beta right now that will see tremendous ROI just in the manual labor involved, and other costs involved. And essentially, as soon as that patient responsibility is known, we can get a digital invoice out to the patient automatically, or we can charge a card that's already on file automatically, depending on what type of process the organization has for payments and what kind of agreements they've entered into, or prior authorizations they have with their patients. But we can bill a card automatically, or we can simply reach out and provide that digital invoice experience. So through text or email, patient can click a link, put in their date of birth, see everything explained very simply, be able to access a card that they already have on file, just like Amazon. Amazon has all of our payment on file, Apple, Google, all of these companies, they keep our card on file. Healthcare is going to do that too. And then the patient can easily just tap to make that payment. So we're talking about, almost instant collections, right? As soon as a balance is known, getting that bill out to the patient, collecting that bill electronically, like consumers want, sending that back into the practice management system, noting on their account that the payment was made, applying it automatically to the right appointment. If anything fails along the way, a payment doesn't get made in a certain amount of time, or any other edge case scenarios happen, notifications can be dispatched to staff to follow up where needed. And I think at the end of the day, there's going to be a lot less manual effort. There's going to be the experience that the patients want. Payments are going to happen faster, and they're going to happen more often because it's in a format that it has become the norm. Digital and electronic payments are the norm, and healthcare is lagging behind. And Mend has these types of experiences available today, and there's lots of benefits to the organization for when you move to digital.
Incredible stuff today. Can you summarize the journey for us and how Mend is working to realize this vision so our customers can help more people?
Yep. So we touched on it. So patients are going to schedule their own appointment, maybe cancel, confirm, reschedule. We're going to have AI that changes appointment reminders dynamically. Digital forms will be done electronically and move back into the patient's chart. We'll have a check-in process that's digital that consumers want. As part of that process, co-pays can be collected automatically, self-pay amounts, other amounts. If it's a telehealth appointment, AI can determine who might struggle and help with interventions. During the digital check-in, web camera is going to capture those vitals for us. If there's a wait, there's going to be new waiting experiences that are going to boost satisfaction and loyalty. Language barriers are going to be a thing of the past, whether it's captions, translations, sign language. AI is going to assist the clinician in being able to chart and do some documentation automatically. If there's still outstanding balances after the visit, those payments will be collected digitally and all automated. And once again, I think we can move back to an experience where the patients and providers are just simply connecting and providing care.
The future could not be more exciting. I can't wait to see it unfold here at Mend. Before we move on, we wanted to ask you all a quick question. What was the most exciting innovation you saw today that would help your healthcare organization? You should all see the question now. I'll give you a few minutes to answer. And I do want to note that you can pick more than one if you're having trouble choosing. And once everyone, for the most part, answers, I will share the results. So it's looking like a lot of you have answered that AI vitals with a webcam. Let's see. Also followed by the automated note taking and charting. And both for patient attendance predictor and automated payments. Thank you everyone for answering that. Our audience may or may not know that Mend is a complete patient engagement platform for any type of visit. Matt, can you explain this further for our audience today?
Yeah, and really just two quick slides left before we start answering questions. So feel free to start thinking about anything that you want to ask before we conclude the event. But I think everything that you've seen today is really any type of an appointment, right? And that's really foundationally how Mend is built. Mend isn't just a telemedicine platform. It's a complete patient engagement experience. This vision that we've laid out for you today, this is where we're headed as a company. This is a vision for the company and the future that we're working towards. So we have all of these different modules available. So with one vendor, one partner in Mend, one integration, we can really put a complete digital health strategy together, a complete patient engagement strategy, whether it's digital front door, during the visit, after the visit. So appointment reminders, payment capture, patient self-scheduling, our AI attendance predictor, telemedicine. We have amazing telemedicine workflows, digital forms, two-way messaging, and a lot more. So think of Mend as a platform and really being that partner that allows you to consolidate maybe a lot of point-based solutions, really work, have one integration, maintain one integration, but really leverage lots of different digital touch points with the patient in one platform, which is Mend.
If you are looking for more informative content, we keep a library in the resource section of the mend.com website. In March, Matt authored a webinar and ebook titled 12 Telemedicine and Digital Health Engagement KPIs Every Executive Should Know. Not only do we identify important KPIs, but we share our data to use as a benchmark. Simply navigate to mend.com, click on resources, and you can access all of our on-demand content. And with that, Matt, let's go ahead and jump into the questions. As a reminder to our audience, Zoom has a Q&A option in the toolbar to make it easier for us to answer your questions. Okay. Jane asked us a question: when will automated payments be available?
Yeah, so for those that are interested in payments, we have what we call sort of advanced payments available now through integration, where we can use a combination of digital invoices, connected up to the practice management system, get those patient balances, send everything out digitally, collect payment, and write that back. In the very near future, we are working on our digital check-in process. And so payment before the visit is something that we're still working on. We can capture the credit card before the visit through patient self-scheduling. There's other things we can do with payments before the visit. But really building that into a digital check-in process is something that we're still working on. But everything you need for after the visit has happened and making that digital, that is available today.
Bobby asked, does this solution use a calling feature like Zoom or Teams, or is it its own platform?
Yes. So Bobby, great question. Most of everything is our own platform here. We have web-based video for telehealth, which is very easy to use. But we do also integrate with Zoom, Teams, and WebEx. So in some cases, maybe for group visits, there's more capability there. We also have our own technology to dial out from a telehealth visit. There is a presentation that we did a few months back called 19 Essentials for Telemedicine, 19 sort of essential learnings for telemedicine after over 4 million visits in 2021. We really go in depth in that on-demand webinar, and there's an ebook for that. So we have a dialer and visit, we have our web-based video, but we can also integrate with some of the other video conferencing technologies if that makes sense for the given workflows. Primarily, Mend is a workflow platform, right? We can create all of the business rules and all of the workflows to really facilitate that entire patient journey and have digital touch points with the patient all along the way, before the visit, during the visit, after the visit. So Mend is really a complete patient engagement platform. And we do have our own video, but we can also integrate.
We have an anonymous attendee here asking, will this PowerPoint be available?
Yeah, so we always share the presentation, and then we always have an ebook that I write that goes along with these presentations. So after the fact, everybody will get the PowerPoint, everybody will get the ebook, and the ebook is a little bit nicer because it has a lot of the context, has a lot of the things that we've discussed as well. And then these are always made available on demand, not too far after the live event.
And then we have a question here from Chrissy. She's asking for AI note taking. Will the data write back to the EHR database?
Yeah, hi, Chrissy. Good to hear from you. A great customer of Mend out there in Hawaii. So, yeah, yes, I think that ultimately the EHR has to be capable of accepting the information back. Now, and knowing what I know about Chrissy's EHR, yes, I think all of the data could be written back. So some of it is dependent on the capability of the EHR for whether that gets depending on what can be moved discreetly and automatically, that could vary depending on the EHR. But in Chrissy's case, yeah, all of it could be moved back automatically.
And then Chrissy has another question here, which we briefly covered earlier, wanting to know about those, the web camera vital captures, if there needs to be a specific camera for the patient to use.
No, not that I've seen. Even moving around, changing distances, really trying to disrupt or break that technology. It's already pretty darn good and only getting better every single day, just using cameras that everybody has in their smartphone or on their laptop or their webcams. So there really aren't any special requirements for the cameras.
And then let's see here. We have a couple questions relating to EMR or EHR, recommending that either work well with Mend.
Yeah, so Mend integrates with over 81 different EHRs. So definitely feel free to reach out, depending on, I think, maybe depending on the specialty. We might have a different opinion on which EHR maybe has a lot of these write back capabilities, so on and so forth. So one thing that we are not is we are not an EHR. We are not a billing system in terms of billing insurance companies. There are thousands of systems that bill insurance companies or will handle the documentation. So we are not an EHR practice management system, but I think there's definitely, we definitely make some recommendations, maybe given the specialty and given a little bit more information. My email is on screen here, as we might not be able to get to all of these questions. So feel free to email me, or if you want to see a demo, you can schedule a demo and we can maybe make some further recommendations once we have a little bit more information, just to try and point folks in the right direction.
Okay, and I think we have time for one more question before we wrap things up. Tom wants to know, is everything shown today for telemedicine visit, or what about in-person visits?
Yeah, so I think our view of the future when we started the company was that some percentage of visits would be virtual, but probably the majority of visits will still be in person. Now, for behavioral health, that's not the case anymore. But for a lot of other specialties, there's still going to be a lot of cases where you've got to physically, see a patient, lay hands on a patient, so on and so forth. And so we really wanted to build Mend to be a complete patient engagement platform, so that any type of visit, so we do in-person visits, virtual visits, phone call visits, home visits, you name it. There can be group visits, right? Kiosk visits, on-demand visits, anything, any workflow you can think of, we've seen. And Mend is really designed to be one-stop shopping, one partner, one integration, one experience, consolidate a lot of these different separate point-based solutions into one, sort of complete patient engagement platform that can not only support you today, but with this vision we've laid out for the future, really sort of future-proof the organization, future-proof a digital health strategy or patient engagement strategy. Really, I think, we're focused on some of these really big fundamental problems around patient access, administrative burdens, and really trying to create a whole new experience for patients and clinicians in the future.
All right, and that concludes our webinar for today. Thank you everyone for tuning in and joining Matt McBride and myself today. It was an honor discussing this with you, Matt, and we hope you all tune in again next time.
Thanks, everybody.